All right, and we're going to be talking a lot about mammograms, when you should be screened, when you should get one. The first thing I want to talk about is there's something we always hear about creams or deodorants, whether we should use them or not, especially before we do a mammogram. What's the reasoning behind that?
So first of all, the mammogram is a test that uses low-dose X-rays to visualize those internal structures of the breast that we talked about. And it's important to avoid creams, deodorants, powders, because some of these contain metallic materials or calcium that form deposits in the skin and actually appear as artifacts on the mammogram film. And the most common artifact are calcifications, which can be a way that breast cancer presents on mammogram. So these artifacts can result in callbacks, so patients are called back for additional screening,
just in
or
case.
they can result in unnecessary biopsy. So it's very important to avoid these issues.
Is it also good to avoid caffeine before you do a mammogram? I've heard that too.
So if you have sensitive breasts and if you are concerned about pain during your mammogram, there are certain things that we recommend to try to lower the likelihood of that occurring, and avoiding caffeine, as you mentioned, is one of them. So we typically recommend that you stay away from caffeine for 1 to 2 weeks prior to the mammogram, because caffeine has been shown to make the breast more sensitive. We also recommend that you can take ibuprofen 1 hour before your mammogram to try to lessen the inflammation, and also try to schedule your mammograms during a time of your menstrual cycle when your breasts are less tender.
Which is hard to do because you kind of book these things a long time in advance, and that was my next question. And how are you supposed to calculate that? But it's best not to do it like when you have your menstrual cycle.
The best time to do it is really the week after your period, which is, when I talked about those hormonal changes, it's really when the hormonal changes are at, the hormonal levels are at their lowest, so the breasts are less sensitive. But like you said, it is hard to plan ahead,
hard to calculate
especially if you don't have, if your menses are not regular, but that's another one of the recommendations.